Monday, and it's time to talk technology. Luis Alvarez, CEO of the Alvarez Technology Group, joining us right here on Power Talk 1460 and 101 FM. Good morning, Luis.
Good morning, Mark. How are you?
Doing well. So today we're going to talk about the bad news robot, and it's a new way of providing medical information to patients, but sometimes, well, I don't know if it put its best foot forward, if it has feet. Anyway,
yeah.
tell us what happened.
Well, over the weekend, there was a news story about a family that complained that their father, who had late-stage cancer in his lungs, passed away, had gotten the news that his cancer had gotten so bad that he wasn't going to live from a robot. And what's interesting is I've seen that robot in action, and it's kind of a new wave of what's called telemedicine. That is the ability of doctors to deliver healthcare from remote locations to healthcare facilities all over the world, really. It's something that you're probably going to see at some point when you go to the hospital or go to a clinic that's remotely located, and this doctor essentially is sitting behind a computer screen where he's at or she's at, and then using the robot to communicate with a patient that may be on a hospital bed or maybe being examined. But it's not going to be something that happens for the last time. Unfortunately, it's a little shocking, but the reality is, as we try to find ways to reduce the cost of delivering healthcare, robots are going to be part of that equation.
So the doctor can't pick up the phone and call you and say, "I'm really sorry to tell you this, but your condition is terminal."
I guess the question becomes, yeah, they can probably call you on the phone, but would you prefer to have that message delivered via the phone or with a live screen so you can at least see the face of the doctor who's giving you the bad news?
Well, where does the robot come into this, though? I mean, if the doctor's there on the screen talking to you via some sort of video conference, teleconference hookup, then what's the robot needed for?
Well, the robot's a mobile manifestation of that screen. So rather than having a computer screen that sits on a desk, essentially you have a rolling computer screen that can go to a patient's room and then move someplace else or go throughout a healthcare facility, whether it's a hospital or a clinic, and let that doctor move with it.
So it has a television set in its belly.
In its belly, yeah. It stands about 5 feet tall, and the screen is about eye level to most people. It has a camera so the doctor can see you, and you can obviously see the doctor in the other end. And the doctor can direct nurses or physician's assistants to do treatments while he or she watches. And they're his hands, but he has eyes and ears on the problem, so he can diagnose things. And in so many healthcare requirements, a doctor is needed to prescribe or to make the final diagnosis. And this is just a way to get a doctor someplace where doctors may not be available so readily.
Are we going to see this in our area here soon?
Oh, yeah. Actually, I think both Montage and Salinas Valley Memorial Hospital are experimenting with them. And you might even see them in your home at some point when if you're a patient being taken care of at home, and these robots will be loaned out to you.
What do you suppose it'll say or respond if you say to it, "Klaatu, borada nikto"?
Hopefully it won't destroy the world.
There you go. Luis Alvarez, CEO of the Alvarez Technology Group, has been our guest today here on Power Talk. Online, it's alvareztg.com. @AlvarezTG is a Twitter handle. And Luis, the toll-free number for the I-Team.
Give us a call at 866-78-I-Team. That's 866-784-8326.